You can create a new health system that you can start with a primary care practice that focuses on quality and safety. And you can advertise yourself to consumers that way, that we practice safer medicine here.
Vítajte, počúvate podcast Rozhovory MD. Moje meno je Tomáš Havran. For English speakers, please bear with us. This introduction is in Slovak, but our whole conversation with Michael Cannona was in English. V dnešnom podcaste som sa rozprával s riaditeľom jedného z najznámejších think tankov v Amerike, ktorý sa volá Cato Institute. A tým riaditeľom je Michael Cannona, ktorého na Slovensko pritiahol Ines. No a Cato Institute zastáva libertariánske myšlienky pri formulujúcej sa regulácii hlavne v Amerike, ale aj rôzne po svete. A nie len v zdravotníctve, ale aj v zdravotníctve. Celý náš rozhovor je samozrejme v angličtine, ale tak verím, že aspoň to bude dôvod si oprášiť svoju angličtinu, jazyk, ktorý naozaj každý lekár by mal vedieť. No a v tomto rozhovore sme sa rozprávali samozrejme o voľnom trhu v zdravotníctve, aká je jeho úloha, ako to môže vyzerať. A takisto sme sa rozprávali o zdravotníctve v Amerike, ktorý z nášho pohľadu slovenského vyzerá ako veľmi trhový systém. A možno aj je, ale zároveň Michael Cannona argumentoval, že ešte tam vidí veľa priestoru na zlepšenie a na oveľa viac trhu v tom zdravotníctve, ktorý by mal práve priniesť lepšie výsledky. No a moja úloha toho menšieho libertariána v tomto štúdiu bolo klásť mu otázky podľa možností také, ktoré budú nejako narážať na jeho argumenty a prípadne sa ďalej dopytovať. Zároveň sme sa rozprávali na veľmi zaujímavú tému, čo sú medical errors, ktorý tak vyplynul z toho nášho rozhovoru, takže je sa na čo tešiť. Tak ako aj ostatné epizódy, aj túto vám prináša farmaceutická spoločnosť Krka Slovensko s motom Žiť zdravý život. Michael, welcome.
Thank you, Tomas.
Welcome to our podcast. It's a pleasure to have you here. There are so many topics to tackle in such a limited time. So let's start with some basics and maybe let's frame it a little. So, Cato Institute, what's your stance on healthcare policy, healthcare systems in general?
Thank you. So the Cato Institute is a libertarian think tank in Washington, D.C. We've been around since 1977, and a libertarian means that we think that all human beings are highly and equally valuable. We believe in the equal dignity of all people, and that you have a right to live your life however you want, so long as you respect the equal rights of others. And what that means, you wouldn't think that was a very controversial concept. It turns out it's very controversial in capitals like Washington, D.C. and many other capitals around the world. But what that means in healthcare is that you do have rights when it comes to your healthcare. You have foremost, you have the right to make your own health decisions. And when governments and others respect that right, then wonderful things happen. Free markets make healthcare better and more affordable and more secure and more universal by driving down prices, by improving quality, by developing innovations that treat diseases we previously could not treat or cure diseases we previously could not cure. That market process makes healthcare more universal. So if what you want is universal healthcare, what you want is free markets.
All right. There has a lot of silver lining, obviously, and a lot of critiques, a lot of critique that kind of goes with these words which just uttered. And I guess in a lot of events, you have to deal with that critique, and we might get to that a bit later. In the beginning, you have a lot of experience, a lot of insights into U.S. healthcare system. And I have a challenging question for you because we have limited time. Could you elaborate, or maybe could you introduce us, explain U.S. healthcare system briefly, maybe like up to 5 minutes? How does it work?
So, the U.S. health sector is 1/6 of the U.S. economy. So it's a massive part of the U.S. economy. And it is not one system that serves everybody. There are multiple different ways that people obtain provide and obtain medical care. For the most part, most U.S. residents obtain their health care from private sector healthcare providers, and they pay for it through various insurance schemes. A majority of the U.S. population gets their health insurance through employers. That's a result of a government intervention that created that system. But then a third or more of most of the rest get their health insurance through government, through two major programs, both run by the federal government. The Medicaid program is ostensibly for low-income people. The federal government provides money to states, the 50 states, who then operate these Medicaid programs. There are about 70 million people who enroll in that program. There's about almost 70 million people in another federal healthcare program, Medicare, which is for the elderly and the disabled, and that is run entirely by the national government. And then there are other smaller markets or programs. We have a managed competition system like you'll see in Switzerland or Netherlands. And in the United States, we call it Obamacare because President Obama enacted it. That is heavily regulated private insurance that covers about 10 to 20 million people. And we also have in the United States a completely government-run health system where not only does the government pay for the medical care, but it also owns the hospitals and hires the doctors. It is just like the British National Health Service. We call it the Veterans Health Administration. It covers about 1% or 2% of the population who are veterans of the U.S. military. So, and then there's also a chunk of the population, and I think it's about 8% right now, that do not have health insurance at all.
How does that happen?
It's a good question. So there's a lot of people who look at the U.S. health sector and see that because the private sector plays such a large role, larger than in most other countries, that we must have a free market in healthcare. But what I've just described is lots of and massive government interventions into the health sector. And they're interventions that drive up the price of healthcare prices and health insurance premiums, making them unaffordable for millions and millions of people. And so that is the major reason why there are so many people in the United States who lack health insurance. It's not because we have a free market. It is because the government has intervened so heavily in so many ways that drive up healthcare and prices and health insurance premiums that many people cannot afford it, or they realize, oh, there's a government guarantee waiting for me. If I decide to buy health insurance, I'll wait until I'm sick and buy health insurance then. And so what I like to say is we have in the United States, not only do we not have a free market, and not only do we have socialized medicine, we have every form of socialized medicine that exists in the world in the United States, and we've even innovated with some forms that no other country has. So, and it is a result of those interventions that the U.S. health sector is the most expensive in the world and consumes such a large share of U.S. workers' incomes and the U.S. economy.
All right. So your argument why U.S. healthcare is so expensive is that it's over-regulated in some areas and that drives prices up. However, there are also other countries where there's a heavy regulation, let's say Germany or Netherlands and so on. And the ratio between how much you pay and how much you get from the healthcare system is probably higher in some of those European countries. Can you maybe elaborate on that?
Sure. So, and that's an excellent point. The problem in the United States is not just regulation per se. It is regulation plus tax policy plus government subsidies. So many regulations increase healthcare prices, sometimes by accident, but sometimes by design. And when these regulations increase the price of healthcare or prices for health insurance, the industry tends to like that a lot. Mm-hmm. And so they spend lots and lots of money to preserve those regulations. In fact, lobbying expenditures by the health sector of the economy outweigh lobbying expenditures by the defense industry in the United States by a factor of 6. So think of the U.S. military and how massive it is and how much it enriches defense contractors. They don't spend nearly as much money to lobby the federal government to enact and preserve regulations and tax policies and subsidies nearly as much as the health sector does. So there's some regulations, many regulations that increase prices, but probably most of the impact comes from tax policy and spending policies.
What does that mean? Tax policy,
so tax policy, the reason that most U.S. residents have health insurance through an employer is because the federal government taxes your income if your employer provides it to you in cash. But if your employer provides you health insurance, the federal government does not tax that. So you avoid, at the margin, a 33% tax on those funds, on that compensation, if your employer provides it to you as health insurance. That distorts people's economic decisions in many, many ways, but the upshot is it dramatically increases healthcare prices and health insurance premiums. So that's not a form of regulation per se. In fact, it was an accident. Congress didn't mean to do this initially. It just sort of happened as a result of bureaucratic fiat.
And lobby, probably, right?
Well, now there's lots of lobbying to preserve it because it serves the interests of the healthcare industry because it penalizes you for every dollar you don't spend on healthcare. I mean, wouldn't it be great if the federal government, if the national government penalized people for every dollar they didn't spend on libertarian health economists? That would be a wonderful world that we would live in because my income would be much higher. So the healthcare industry does lobby to preserve that tax policy, but so do large employers. They benefit at the expense of their smaller competitors. But the people who suffer are, that 8% of the U.S. population that's uninsured, that can't afford the medical care that they would like to be able to purchase or can't afford health insurance. But also workers suffer because they lose control over their health insurance and healthcare decisions, and they have to pay such higher prices. And we're not even done yet because government spending policies also drive up prices in the United States. The Medicare program is the largest purchaser of healthcare services in the world. The Medicaid program is among the top 50 because the states purchase so much healthcare, and they purchase the fact that they purchase medical care at all drives up prices in the private sector. And the way that they purchase these services, the way they set the prices for them often increases prices as well. Take, for example, the Medicare program and how it pays for medications, drugs that your physician administers to you. Say you have cancer and you need chemotherapy. When the Medicare program pays for these chemotherapy drugs, what it does is it says we will pay 106% of whatever the drug manufacturer charges private payers. So what impact do you think that has on the prices that the pharmaceutical companies charge to private payers?
And that's regulation.
That is a condition on government spending. It's a little different from regulating private actors and how they behave in the market. It is the government saying, here's how we're going to spend our money. And if they say that the price that a drug company gets out of the government is something the drug company can control, and that if the drug company increases the prices it charges to private payers, they get more money from the private payers and more money from the government. That's what they do, and so the prices end up being higher as a result of government spending policy as well as tax and regulatory policies.
All right. So these programs, and probably, if I understand correctly, or maybe I'm going to be simplifying a lot here, okay? But what I get from this is that you have a regulation which sets different players, or like their motivation is not really aligned maybe with the outcomes of the patient, but rather, if they're private players, obviously they want to create some profit. And when the regulation is not so set up that the increase in profit also equals increase in outcome, or like health outcomes of the patients, then that we have a problem. And also you have programs that do not probably look so much on the efficiency of the spending, but rather the coverage, right? Do I get that somehow correctly?
I interpret what you're saying to be that oftentimes when the government encourages more health insurance because it doesn't want people to go without medical care, that they're not focusing on efficiency, and there are a lot of inefficiencies that result. And if that's what you're saying, I wholeheartedly agree, and I think that happens wherever the government tries to encourage more health insurance than people would purchase themselves.
All right. You also said that there's a lot of lobbying, 6 times more than in a defense industry.
6 times more than the defense industry spends, yes.
So that's probably a lot. So, and I also see this in Slovakia that sometimes there's some lobby, and probably is not such a extensive industry as in the US, but sometimes we argue that the state or the let's say people from the ministry or like these regulators, they are not very good negotiators because sometimes the companies push them on. Maybe they push them into categorizing a new medication or somewhere, right? Or maybe the regulator is not controlling their own regulations, that the players are basically playing by the rules, right? So what does this strength of the regulator or strength of the state to actually kind of check whether the players are playing by the rules and maybe giving sort of like a barrier or so how do these people in the government or regulators should behave so that the sector is somehow aligned with the vision to get to the best patient outcomes?
It's a good question. How should regulators behave? It's an interesting question, but a more interesting question is how do regulators behave? Never mind how they should behave. How do they behave when we give them power over people's health care and people's health decisions? And what ends up happening is when you empower the government to control health care, and this happens in every country, you are empowering the healthcare industry to control healthcare.
So if you empower regulators, you empower the industry.
That's right. The incumbent healthcare providers and health insurance companies at the expense of consumers and at the expense of their competitors. Because when you create these sort of regulations, the political system is going to govern how they operate, what sort of rules they impose, when and whether they change them, that sort of thing. And who has the incentive to participate in the political process to influence those decisions? Nobody has a greater incentive than the industry does. Nobody has more money to spend. Nobody has more time to spend. And so the industry ends up mobilizing to influence the politicians and influence the regulators, sometimes by influencing voters that they know that they can mobilize. And when they do that, they end up bending the regulations or shaping them in a way that protects them from competition. And that's to the detriment of consumers. So instead of creating when you empower government to control healthcare, you're not empowering a beneficent philosopher king to keep the industry in check for the benefit of consumers. No, not at all. You're empowering the industry to protect its position, to protect the high cost and low quality incumbent providers from smaller, innovative competitors who would be able to provide consumers something better, provide them lower cost care, provide them higher quality care, and make healthcare more universal.
So now the argument would be like, how do you know that they would be better, they would be faster, they'll be more innovative?
You don't until consumers tell you. And you need the consumer to be free to tell you, hey, this is better. That's the only way we're going to know. And that is the exact sort of question that a regulator or the industry would ask is, how do we know that they're going to be better? We don't. We can't trust that these people will be better, so we have to stop them. But what you're saying there is you're saying we're going to take away the consumer's right to choose for herself whether this insurance company or this drug company or this physician practice offers them, or this telemedicine company offers them something better than what they had before. You're taking away, as we discussed at the beginning, their fundamental human right to make their own health decisions. And you're doing it not to help them, obviously, because it doesn't. What you're doing is you're doing it to protect the incumbent insurers and healthcare providers from competition.
All right. What else, or like what would help? Less regulation, I suppose. Or maybe what else, or like what kind of what are the sensible regulations in your view that would maybe also help the consumer to choose better, right, or so on?
Well, the reason most people support government intervention in healthcare, a government guarantee of access to healthcare, whatever shape that guarantee might take, is because they're so afraid that there would be people without the means to obtain the healthcare that they need. Those people will live and suffer with illness and die early. And they want to do something for them. And there are ways to help them that don't create the sorts of problems that we're talking about right now, that don't empower the industry. So if what you want is to redistribute resources to those people, the government can play a role without creating the sorts of regulatory capture that we've been discussing, without keeping healthcare prices high and protecting low-quality providers. And that is to subsidize, if you want to subsidize people with high disease burdens, you can do that, but give them the money directly and then let them choose how to spend it. And the process, and you can give sick people more money so that they can afford the medical care they need or a basic package of health insurance. And the way to do that is actually closer at hand than you might think. Because in many countries, including Slovakia, what you have is you have a system where there are multiple insurers from which consumers can choose. And the premiums that the insurers charge to the enrollees don't vary with risk. They vary only, the premiums are what we call in the United States community rated, so that healthy or sick people don't pay more than healthy people. But what economists know is that those sorts of premiums encourage insurance companies to provide low-quality care to sick people, which is what we don't want. And so what the government does is it tries to provide those insurers more money if they get a sicker enrollee so that they have an incentive to provide them quality care. Okay, so you've got this program where the government looks at how sick a person is and pays the insurance company based on that. If what you want to do is subsidize the sick, what you should be doing instead is taking that money, whatever that amount is that the government plans to give the insurance company, take that a higher amount of money and give that directly to the sick patient that you want to help. And then let them decide if the insurance company is going to get it and which insurance company is going to get it. And let the insurance company charge them a premium that corresponds to their health risk so that they're charging sick people higher premiums. And we don't have to fear that because we've given those sick patients more money so that they can afford those higher premiums. But you've completely changed the game by giving the money to the consumer, because then the insurance company has to serve
check
them.
or like free money that they can spend also on, let's say, lollipop, right? They can only spend it on healthcare.
If what you want is for the health sector of the economy to be to make healthcare as universal as possible, then you have to give it to them as cash.
Right.
Because you have to force the health sector to compete with the lollipops or whatever else they want to spend, the consumer might want to spend that money on. Because if you guarantee the health sector that this money is coming back to them, they are not going to innovate. They are not going to drive prices down. They're not going to sell themselves to consumers and educate consumers on the importance of medical care as they will if you force them to compete.
Understood. So what might happen, and it probably would, when you give people kind of free cash, even if they're sick and they should spend it on healthcare, they probably, a percentage, let's say 2%, 5%, are not going to spend it on healthcare, and you have the same problem as you had before. How can you overcome that with your argument, or like with the system you're suggesting?
We may not be able to overcome that. I don't know if it would be 2% or 5%. It might be 1% or less.
Yeah, maybe 0.5%.
But let's say it's 2% of the people will not buy healthcare, and their disease burden will be greater, or they will suffer. We may not be able to solve that problem, but we don't need to solve. We may not be able to solve that problem, but we should still do it, because the people who are being left behind right now are a greater share of the population than 2%. It's 10% or 30% who are suffering because medical care is inaccessible to them, because they are not the quality innovations that could be reducing their disease burden or making them happier with the care that they are receiving. So in the United States, for example, there are estimates that medical errors are the third leading cause of death, my view is that the reason that happens is all the ways that the government intervenes in healthcare reduce the penalties that markets would otherwise impose on providers who injure their patients through negligence or other sorts of error. And so that is a much bigger than a 2% problem. And if you want to reduce those sorts of problems, you need to make the health sector more accountable to patients, and along the way you will be. And so no health system is going to be perfect. This is a human endeavor. People will always make mistakes, but when you empower government to make these decisions for consumers, you still have humans making these decisions. They're not wise, perfect philosopher kings who are making these decisions. And the mistakes that they make end up injuring not just themselves, but other people. And so those mistakes persist year after year and decade after decade. And you end up with a much bigger problem than a 2% problem. So a free market in healthcare doesn't have to be perfect. It just has to be better than the alternatives. Or as we say, I don't have to outrun the bear. I just have to outrun you.
All right. I'll stop pushing because, we don't really know how would that influence, like whether it will be 2% or 5% or maybe 0.5%. It's kind of hard to run the simulation as well. And also from a healthcare policy point of view, we need to know what we want to focus on, what's our vision, where we want to get to. And always, if we decide to go one direction, we need to neglige something, right? But one interesting thing that you mentioned, that medical errors or healthcare related errors, I'm not sure what the metric exactly is the third highest leading cause of death in US. In Slovakia, this is not really a topic. I remember in US in 2000 there was this article stating, I don't remember the name of the article, but that kind of started the debate of that there actually is a medical errors. There are medical errors in healthcare, and it's funny that we're not there yet. Can you elaborate on that a little?
Absolutely.
And how maybe we could also in Slovakia, what we should do to prevent medical errors that for sure happen, and sometimes we don't even know.
Right. So I think the article to which you refer is a report by the Institute of Medicine. The title was "To Err is Human."
Oh, yeah, true.
And they estimated at the time that the number of people in the United States who die from preventable medical errors every year is somewhere between 50 and 100,000 people. Since then, there have been other studies that came up with estimates that are even higher. One study put the number at 250,000 per year. Another put it at 400,000 per year. We don't really know. But what we do know is that there are multiple studies estimating that looking at patient records and trying to identify errors that caused or contributed to the patient's death, that have found that the numbers are staggering, that have come up with estimates that are just staggering. And we also know that there are government policies that disable the market mechanisms that would otherwise be punishing these healthcare providers, if only by providing better alternatives and driving them out of the market. And I can talk about what those policies are, but there are government agencies who have said, hey, you know, the Medicare program sometimes rewards healthcare providers when there are medical errors, because if they injure a patient with a medical error, they get paid first for injuring the patient, and then the Medicare program pays them again to try to fix the problem that they created. Those sorts of incentives would not survive in a market system, because market systems develop innovative health plans that have the providers internalize the costs of making the patient whole again, fixing the medical error, and so encourage them to invest in processes that avoid medical errors. But the government, through regulation, through tax policy, and through spending policy, has been either blocking those innovations or heavily subsidizing the competition. So it should not surprise us that in the United States, medical errors are such a problem. And it also doesn't surprise me that in Slovakia, you're not even having the debate about medical errors that we're having to a small degree in the United States. And that's because when you have the government play such a heavy role in the health sector, the debate tends to serve the needs of the incumbent providers in the health sector, not of consumers. And so it would be very difficult for you to make that a prominent issue in the national debate over healthcare, because you would have to do the research, you would have to publicize that research, you would have to put on events and have lots of meetings and maybe even buy advertisements in the media just to get the attention of the public and policymakers. But a market system you don't need to do any of that in a market system. Because if you're an entrepreneurial young doctor who has been to a hospital and is just absolutely horrified at what he has seen, the lack of hygienic procedures, the lack of checklists for inserting a central line so that there are lots of errors that happen there, the lack of quality control when you're trying to determine which patient gets which medicines. And so you get some patients getting the wrong medicine, others just getting the wrong dose. You can go into business for yourself. You can create a new health system that you can start with a primary care practice that focuses on quality and safety. And you can advertise yourself to consumers that way, that we practice safer medicine here, and that will drive home to consumers that medicine is often unsafe and that they should focus on that sort of thing. And if you don't do that, then some other entrepreneur will do it. And because when there are opportunities to benefit patients like that, Adam Smith's invisible hand guides providers to meet those needs. But that doesn't happen when the government is the buyer of healthcare or is regulating these sorts of innovations out of existence. So it doesn't surprise me at all that you're not having the debate about medical errors in Slovakia that we've had in the United States. Sadly, it also doesn't surprise me that we haven't fixed that problem in the United States. But again, the reason for that is that the government has intervened so heavily that it's disabled those market mechanisms.
It's also a difficult problem to solve because the consumer, the patient, let's say in Slovakia, right? The enrollee, you said, is that the word?
Right.
In the insurance company, the patient.
Yeah,
they don't.
The consumer, once they buy into health insurance, but before they've gone to the doctor. Yeah.
All right. So they consume the services, but they don't pay for them. Also, they are not medically trained, so they can't tell whether a mistake happened or it was just by coincidence or something. The insurance company usually, well, at least in Slovakia, they don't see the patient outcomes or they don't see the healthcare record. there's a regulator who sets some standards, but sometimes fails to check them, whether they're actually, whether the players play by the rules. Then we have an agency that should look after the quality, or whether some errors happen, but obviously they don't have so much staff to actually do it on a broader basis. So what I'm trying to say is that there is not a stakeholder who would push to, and also let's say the providers, they when they know that they're going to get paid anyway, there's not such a strong push to report errors or to actually fix them, because that kind of shines a bad light upon these players who actually start reporting errors, start reporting nosocomial infections, and so on and so on. So it's a very tricky subject for sure. But I just wanted to kind of highlight this medical errors. Just sprung from this talk as an important concept in healthcare that we should at least talk about.
And it's a very difficult question. And the point you make about the patient not being able to know, not having the knowledge to be able to judge whether they were a victim of a medical error or not, is really important, because it's true, but it also indicates that, the problem is actually much bigger than that. Sometimes doctors don't know if a bad outcome was a result of a medical error or not. Those studies that I mentioned, the reason why they vary from 40,000 to 400,000 deaths per year in the United States from medical errors is because even doctors disagree about whether whether there was an error, and if there was an error, whether it led to a bad outcome. And that's because healthcare is so incredibly complex. The human body is so incredibly complex that it is difficult even for experts, doctors, to know whether what a doctor did or what a pill did was responsible for a good outcome or not responsible for a bad outcome. Because there's so much other stuff going on inside the patient, including the patient's body trying to heal itself, that it's often impossible to judge without massive amounts of data to conduct studies, preferably randomized controlled studies, to ascertain whether this drug works. That's why, say, the US FDA and other regulators around the world require large randomized controlled studies before they'll approve a drug, because you have to do that sort of thing because medicine is so complex. That's the only ways that's the only way to reduce the uncertainty. But here again, we see the influence of government intervention disabling market mechanisms that would otherwise provide the sort of data we need to make those judgments. There are health plans that just by their nature collect lots and lots of data that help us understand what's happening, what the effect of different medical interventions and processes for performing those interventions. In the United States, we have one of them that's been very prominent for 80 years now. It's called Kaiser Permanente. It's basically a private sector version of the British National Health Service, or the U.S. Veterans Health Administration, where the health plan and the providers are all sort of part of the same corporate entity. And in a system like that, the incentives for the providers are very different when they get paid for each additional service they provide. There, you provide more services, you get more money, including if you injure someone and then fix the problem you caused, you get more money that way. That's how the Medicare program operates. But under these other sorts of health plans, the provider internalizes the cost of those errors and so has an incentive to avoid them by investing in electronic medical records that help prevent them, investing in other quality improvement activities. And once they've invested in those medical records, they can collect massive amounts of data that help them solve these problems. And the example I like to use, and I use in my recent book, is that Kaiser Permanente of Northern California was able to use their electronic medical records system to identify that a drug called Vioxx was causing heart attacks and killing some of their patients. Vioxx was a painkiller. It was not supposed to. People would not have guessed that it would have this side effect, and the FDA approved it, thinking that it would not have this side effect. But because Kaiser Permanente has this massive electronic medical record system, it was able to identify that adverse drug reaction, and it did a better job than the government did of identifying an unsafe drug. But at every turn, in the United States and in other countries, government has been disabling the market mechanisms that would give rise to those plans, and so patients have been suffering as a result. And so the problem is much bigger than a 2% problem. That we have all sorts of unsafe medicine that doctors are practicing out there because they don't know any better, and they don't know any better because the government has prevented them from knowing better.
All right. Our time is running quite short. I have two topics that I would like to tackle. And in Slovakia, there's a lot of debate whether we should have, let's say, public providers, public insurance companies, public stakeholders in the sector, or we should privatize, or what's the role of the private players, basically. I suppose from what you just are saying is that you would like to see the most of these providers as a private providers in some regulated, not over-regulated market. However, in Slovakia, there's quite strong accent of private players such as hospital chains or pharmacies or insurance companies. And there's this trend of privatization. What do you think? Where does it lead to in this environment? Not in an ideal environment where there's a free market and everything is beautiful because there's a lot of competition and so on. But in this 5 million Slovakia, this privatization, where does that take us? And maybe do some public players have some stands here in Slovakia? Are they important?
So it is important to identify where you want to go. If what you want is a health sector that makes health care more universal, and I mean constant improvement, more universal all the time, so that you're constantly developing, driving prices down so that people can afford medical care today who could not afford it yesterday.
That's quite cheap in Slovakia, though, no?
Then it should be universal if it's cheap enough, but it's obviously not cheap enough if you need massive government intervention. If you want to get the prices down as much as possible, you need free markets to do that. And that's important because that is what makes healthcare more universal, is when you drive prices down. It makes it easier for people to afford medical care themselves. It makes it easier for people to subsidize the shrinking number of people, the ever smaller number of people who cannot afford it for themselves. So if you want healthcare to be more universal, you need markets to do that, to drive down prices, to improve quality. And privatization is not enough. Privatization is important, but it's not enough because if you privatize, but still have the government regulating those private sector entities to take away your right to choose another option, or as a doctor to introduce another option, then you're depriving consumers of choices and you are disabling the market process that naturally makes healthcare more universal. And it's also privatization is also not enough because if you privatize and then have the government subsidize those private sector entities, then they don't have to be they don't have to make healthcare as universal as they would in a market system. They can rely on the government subsidies to preserve their inefficiencies, to pay them for low quality care, and whereas a market would do neither of those things. And in both cases, the cases of regulation and the case of government subsidies, the incumbent providers, that the government is going to be protecting are going to take their rents, as the economists call them, their excess profits, and plow them back into trying to influence the government to preserve those regulations and preserve those subsidies. So privatization is not enough. You need to remove resources from the public sector. You need to remove control from the public sector. Give control to the individual consumer, to the individual entrepreneur, and they will make healthcare more universal than government ever could. And again, this is not inconsistent with subsidizing people who are in need. You can still subsidize them, but if you want to do that, you should give them cash and let them make those decisions themselves. And you can give them, as we mentioned before, risk-adjusted or income-adjusted subsidies so that sicker and poor people get larger subsidies. But again, give them the money, trust them to spend that money themselves.
Now, how do you view, let's say, Denmark or these or Sweden, countries where most of the players are, or not most, but there's a lot of accent on public providers, and basically everything is subsidized, and maybe there are some incentives on the hands of consumers, patients. How do you compare that to what you're proposing?
So
because their outcomes are quite good in all the metrics, or most of the metrics.
So that's a good question, and it harkens back to something that you sort of touched on before. I'll first say this about those systems. In the United States, we have every form of socialized medicine, and so I believe in Denmark what they have is a system of managed competition. We have a couple of those in the United States, actually, and what ends up happening in those systems is the government imposes rules that require insurance companies to provide worse coverage and worse care to sick people. So that is not something that I think that they should be doing or any country should emulate. But you raised an interesting point, a really important point, which is...
But their outcomes are good.
Their health outcomes are better than the United States. So how can I say that? Well, again, the United States is a mess. I don't want anyone to use the United States as a model. And if you look at avoidable mortality or life expectancy, the United States does worse than many peer nations, Scandinavian nations in particular, even as we spend a lot more money. So there are a lot of reasons for that. Again, health is a very complex topic. There are things like genetics and behaviors that influence health outcomes. And I haven't seen anyone really identify with a reasonable degree of certainty how much the U.S. health sector holds back life expectancy in the United States versus other influences. But it's a real concern and a real problem. If, however, the lower life expectancy in the United States is just a result of different preferences, like maybe U.S. residents are more risk-seeking, they want to smoke more than some other countries, not as much as the French, but or they want to engage in other risky behaviors, then I'm not sure that that's a public policy problem, because people, I think, have a right to live their lives the way they want and to make those trade-offs for themselves. But another dimension of this quality outcomes comparison, or the health outcomes comparisons that people make, it's something that I think most health scholars and even Europeans don't appreciate when they're making these decisions, which is the United States health sector has a lot of faults, but its greatest strength, I think, is that it develops innovations in diagnostic tests and treatments and even cures for diseases that at a rate that other countries cannot match. And once we develop those cures, they go all around the world and save lives in every other country. The example I like to use is sofosbuvir or Sovaldi, which is a 95% cure for hepatitis C. Mm-hmm. That drug came from the United States. U.S. Scientists in the United States and pharmaceutical companies in the United States developed that, brought it to market, but it's not only saving lives in the United States, it's saving the lives of hepatitis C patients, reducing all-cause mortality among hepatitis C patients by 50% in other countries as well. So Sweden, Denmark, they are benefiting from U.S. innovation, and U.S. innovation is making their health outcomes look better, even though even as the spending that goes into developing those drugs makes the U.S. health sector look worse. So
it's a globalized system. Anyway.
So at least on the innovations are now other features of the U.S. health sector don't go abroad and are not so global, but that's something that's important to keep in mind, which is that the U.S. health sector is saving lives in Sweden and Denmark and Slovakia and everywhere else in a way that the Slovak and Danish and Swedish systems are not saving lives in the United States.
Yeah, absolutely. When we look at the studies, clinical studies that are being done all over the world, U.S. is definitely leading by far.
Right. And it's important to recognize that a lot of the reason for that is that there are government interventions in the health sectors of many European and other countries that end up suppressing research and development into innovations that would lead those nations to sort of pull their own weight when it comes to developing new treatments, new tests and treatments and cures.
Michael, thank you very much for the
It has been a pleasure, Tomas. Thank you.
Pleasure be mine. Práve ste dopočúvali rozhovor s Michaelom Cannonom. Ak sa vám páčil, ak sa vám nepáčil, tak prosím, dajte nám to vedieť. Či už na Instagrame, alebo mi napíšte mail. Budem sa veľmi tešiť na tú diskusiu. Podľa mňa potrebujeme tu viac a viac diskusie rôznych názorov a tak to má byť. Ďakujem veľmi pekne, že nás počúvate a počujeme sa opäť o týždeň.